And now to health matters. The federal government's Basic Healthcare Provision Fund has disbursed nearly 50 billion naira directly to primary healthcare centers across Nigeria since 2023. Officials of the funding support the delivery of the program Basic Minimum Package of Health Services with reported improvements in infrastructure across all local government areas. Under the current administration, over 20 billion naira has also been allocated towards rehabilitating more than 4,000 health centers in 19 northern states and the FCT.
Fellow Nigerians and friends around the world, good day to you all. When I was first appointed by His Excellency President Bola Ahmed Tinubu in August 2023, he made it very clear to me that he expected a unified and harmonious approach to transforming our nation's healthcare system with a keen focus on improvements from the base all the way up to secondary, tertiary and quaternary care. As a former Chief Executive Officer of the National Primary Healthcare Development Agency here in Nigeria, I knew that the President's mandate was well considered, and thus quality healthcare provision at the grassroots of our country remains to be a major focal point for all our efforts towards re-engineering healthcare delivery in all the 774 local governments and 36 states of the Federal Republic of Nigeria. One of the major vehicles that we are using in our effort to transform primary healthcare is the Basic Healthcare Provision Fund, which was established in 2014 under Section 11 of the National Health Act. The Basic Healthcare Provision Fund is an anchor for our sector-wide approach and provides funding for an additional resource base for subnational units, that is our states and local governments, to leverage upon in our collective bid to enhance access to primary health care across all parts of Nigeria. Designed to be financed from at least 1% of the federal government's consolidated revenue fund and also other sources, including donors' contribution, the fund provides a basic minimum package of health services aimed at increasing the fiscal space for health, strengthen the national health system with an implicit understanding the healthcare ecosystem will only be as strong as its foundation, that is the primary healthcare system. From 2023 to date, more than 50 billion naira has already been disbursed directly to more than 8,000 primary healthcare centers across the country through the fund. And this has led to increase in the functionality of the primary healthcare centers, alongside many more ongoing PHC rehabilitation projects across all local government areas of Nigeria. More specifically, under the leadership of the President, the federal government is working with state governments through the IDA Impact Program to support the revitalization and upgrade of thousands of primary healthcare centers across all states and the Federal Capital Territory. This over the past 2 years. In fact, 37 million visits to primary healthcare centers have already been recorded in the first 3 months of 2025 alone, predominantly in our population living in rural and marginalized populations. This is coming at a time when, through the National Health Insurance Authority, NHIA, which is working with states and the private sector, has expanded enrollment nationwide by 4 million Nigerians to reach 20 million Nigerians covered for the first time in Nigeria's history. This added greater affordability and accessibility to the lowest income strata of our society, in line with the core tenets of the Renewed Hope agenda of Mr. President. So even as we upgrade facilities and enhance recruitment of primary healthcare workers, nurses, midwives, we're working to ensure that our people continue to effortlessly access the services that they deserve. We are unifying the Nigerian health sector under the sector-wide approach office led by its national coordinator, Dr. Muntaka Umar Sadiq, which has brought together civil society organizations, donors, states, local governments, and relevant federal institutions to drive one common agenda for development in the Nigerian health sector in a verifiable and transparent manner.